जी
वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देवा सर्वकार्येषु सर्वदा. A very warm welcome to one and all.
It is a matter of great pride and privilege for us to welcome you all on the 12th Convocation ceremony of International Institute of Health Management Research, Delhi.
For the graduating batch today, this is a much awaited event in their life as it is a successful culmination of the efforts put in by them in their academic endeavors with great dedication. It gives a sense of achievement and a sense of responsibility towards fulfilling further commitments. It's a moment of immense pride for them as much as for their teachers, parents, and all those who had any part in shaping their lives so far.
As of now, they have been in the safe environment of the Institute and enjoying the beautiful student life. However, now the time has come to face the challenges of real world. I am sure that everyone has a different definition of success. But remember that the road to success is never straight. The will to win, the desire to succeed, the urge to reach your full potential, these are the keys that will unlock the door to personal excellence.
Our institute has given us all the opportunities to learn, explore, and conquer new horizons through hard work and knowledge. I pray that may Almighty God will be with all of us in our different journeys of success.
दीपांकर मैं एक मीटिंग में हूँ.
Sorry about the glitch. Education is the most powerful weapon which can be used to change the world. It is the empowering tool given to us by our prestigious institution, IIHMR Delhi. As you know, our institute is part of Society of Indian Institute of Health Management Research, which was established on October 5, 1984. IIHMR was the first established in Jaipur, followed by Bangalore and Delhi. IIHMR Delhi is engaged in policy issues, program planning, management and capacity building, mainly in healthcare domain. It undertakes research, training, consulting activities in wide range of areas, including primary health management, population and reproductive health, health economics and finance, NGO management and networking, hospital management, program management, and evaluation of health programs and health IT evaluation and management.
IIHMR collaborates with various national and international organizations and works with them as a partner in various activities like education, research, training, advocacy, and project implementation, disseminating information and sharing of knowledge at the global and national level. We emphasize on networking with the prestigious universities and organizations at the international and national levels.
The postgraduate program in hospital and health management has attained a status of premier program in the country. The program has set high standards of management education in the health sector.
In order to cater the growing needs of the country and Asia-Pacific region, IIHMR Delhi was established with focus on healthcare at both national and international level. Collective leadership and decentralized management has become the way of life in our institute.
We have a vision to become a world-class institute of learning and research in field of management education and capacity development in health sector. We are working ceaselessly to attain new heights of excellence. Achievements of IIHM are not complete if we don't acknowledge the achievements of our students, which varies from having many publications to their credit, to starting an NGO, receiving scholarships and winning national and international awards as well.
All these achievements wouldn't have been possible without the untiring efforts of the faculty and staff. I would like to particularly place on record our sincere appreciation for the visionary and charismatic leadership of our management board, governing board, and academic advisory council who have guided the destiny of the institute to its present state of growth and development. We are deeply indebted to their invaluable contribution.
Since this is a formal procession ceremony, I would request all of you to switch off your mobile phones or put them on a silent mode till the complete ceremony is over, as it can create a disturbance. Any inconvenience is deeply regretted. Please give a round of applause. I'm sorry. Ladies and gentlemen, good evening once again. Now we would like to extend our heartiest welcome to eminent personality and our guest of honor today, Dr. Shuchin Bajaj, Founder Director, Ujala Cygnus Hospitals.
Amongst us, we have a distinguished luminary, Dr. Ritu Garg, Zonal Director and Head, Fortis Memorial Research Institute, our guest of honor today. We welcome you, ma'am.
We are privileged to have amongst us Padma Shri, Dr. Harsh Mahajan, President Net Health, and Founder and Managing Director of Mahajan Imaging, who is our chief guest today. We are honored to have you here, sir, and we welcome you to the convocation ceremony.
With immense pleasure, we would now like to welcome an eminent personality and our distinguished guest for the evening, Dr. Rodrigo H. Offrin, WHO representative to India. It's an honor and privilege to have you amongst us today.
We are also privileged to welcome Dr. S.D. Gupta, Trustee Secretary, IIHMR Society, who is joining us virtually today. With a huge round of applause, we welcome Dr. Sutapa B. Nyogi, Director, IIHMR Delhi, Ms. Divya Agarwal, Associate Dean, Academics and Student Affairs, IIHMR Delhi, faculty, staff of the Institute, media, parents, and graduating students.
Now, we start today's convocation ceremony. We would like to invite Dr. Rodrigo H. Offrin and Dr. Harsh Mahajan, Dr. Ritu Garg, Dr. Shuchin Bajaj, Dr. Sutapa B. Nyogi, and Ms. Divya Agarwal for the auspicious lamp lighting ceremony.
या कुन्देन्दु तुषारहार धवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युत शङ्करं प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्म विचारसार परमा अद्यं जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदां जार्यन्धकारापहम् हस्ते स्वातिकमालिकं विदधतीं पद्मासने संस्थिता वन्दे नां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदा
Thank you, everyone. Plants are the music of the ground, for earth's lips spoken without sound.
With these words, I would like to invite Dr. Sutapa B. Niyogi, Director, IIHMR Delhi, to present a sapling as a mark of respect to our distinguished guest, Dr. Rodrigo H. Offren.
Now, I would request Ms. Divya Agarwal, Associate Dean, Academics and Student Affairs, IIHMR Delhi, to present a sapling as a mark of respect to our chief guest, Dr. Harsh Mahajan.
Now, we request Dr. Preeta G.S., Dean Research, IIHMR Delhi, to present a sapling to our guest of honor, Dr. Ritu Garg.
We request Ms. Nikita Sabharwal, Associate Professor and Associate Dean Training at IIHMR Delhi, to present a sapling to our guest of honor, Dr. Shuchin Bejaz. We request Ms. Divya Agarwal to present a sapling to Dr. Sutapa B. Niyogi. Thank you, sir. I now request Dr. Servalin to present a sapling to Ms. Divya Agarwal.
Now, we would like to invite Dr. Sutapa B. Niyogi, Director, IIHMR Delhi. Dr. Sutapa B. Niyogi is Director and a public health specialist actively engaged in research and teaching at International Institute of Health Management Research, Delhi. She is MBBS from NRS Medical College, Kolkata, and MD in Community Medicine, PGI, Chandigarh, and Diplomat of National Board in Maternal and Child Health. She has a rich experience in public health and is particularly interested in implementation of projects that is relevant to national policies and programs. She has authored several research papers and is a reviewer of many national and international journals. We are privileged to have her as a Director of International Institute of Health Management Research in New Delhi. We request Dr. Sutapa B. Niyogi to present the Director's report.
Thank you, Shweta. Respected, honorable, distinguished guest, Dr. Rodrigo Offren, WHO India representative. Chief guest, Padam Shri Dr. Harsh Mahajan. Guests of honor, Dr. Shuchin Bajaj and Dr. Ritu Garg. Dr. Ashok Agarwal, Trustee, IIHMR Society. Dr. S.D. Gupta, Trustee Secretary, IIHMR Society. Dr. Jigme Singhe, former Minister of Health, Bhutan and WR Myanmar, faculty members and staff of IIHMR Delhi, distinguished guests, graduating and current students, parents and alumni. It is my proud privilege to present in front of you the Director's report on occasion of the 12th Convocation ceremony of IIHMR Delhi. IIHMR Delhi has made substantial progress since its inception in 2008. And all these have been possible because of the far-sighted vision of our stalwarts, Dr. S.D. Gupta and Dr. Ashok Agarwal. We have progressed under the guidance of eminent professionals represented in the Management Board of IIHMR and Governing Board of IIHMR Delhi. The thrust areas of IIHMR Delhi activities include academics, research, training, and consultancies. Now coming to the research portfolio, it has outperformed the last 4 years' output in terms of the number of proposals submitted, number of proposals awarded, and projects completed. In the last financial year, 4 projects were completed, and currently 10 of them are in different stages of implementation. Notable among them are a project to understand the implementation of public health cadre in select states in India, which is now considered a priority in the wake of COVID pandemic. We are developing a model to demonstrate integration of different health campaigns in public health settings that will inform the government to take decisions on rationalizing different campaigns around the year. We are also supporting the Anemia Mukt Bharat program, the Prime Minister's flagship program, through a large-scale implementation project. In the last academic year, we published 28 manuscripts, and 8 additionally are in the different process of acceptance for publication. We are having research collaborations with different international partners, and one such example is with Imperial College UK through the prestigious NIHR UK grant. This has opened up the avenues for offering joint PhD programs by IIHMR University and Imperial College. The grant also emphasizes on improving research skills through online and offline workshops and courses that are currently under preparation. IIHMR Delhi is the secretariat of Southeast Asia Regional Coordination Mechanism Forum, which is a regional center for Global Fund. We are also a technical partner to support activities of Johns Hopkins India Foundation. To enhance our international presence and collaborations, we have signed an MOU with Mahidol University, Thailand, and Emirates Hospital for collaborative research, training, faculty, and student exchange programs. IIHMR Delhi has a Center for Climate, Environment, and Health, which has been designated by Government of India as a Center of Excellence under National Program on Climate Change and Human Health. We have successfully hosted a global e-conference on environmental determinants of infectious diseases in India with specific focus on COVID-19 with support from NIH, which is National Institute of Health, USA. We are providing technical support for vulnerability assessments to different states on the request of National Center for Disease Control, New Delhi. IIHMR Delhi is represented in civil society outreach activities conducted by the National Disaster Management Authority. Our faculty members have presented 16 papers in different national and international conferences in the past academic year. I'm very happy to mention here that IIHMR Delhi represented India in country consultation for Global Alliance for Anemia Action and also in a pre-summit session of United Nations Food Systems Summit 2021. And the title of the session was Stand Up for Women, Women's Nutrition, Economic Empowerment, and Leadership. We are partnering with Health Campaign Effectiveness, which is a part of the Global Health Task Force, for organizing a session in a virtual conference on NTT this September. Also, we are co-hosting a session with Indian Public Health Association in their annual conference this year. Now coming to the training portfolio, IIHMR Delhi, as always, is committed to strengthening our training program. Despite the COVID pandemic, which had influenced and affected almost all of us, we could sustain our activities to the extent possible. In the last financial year, a total of 9 training workshops were conducted and 231 participants successfully trained. In the last 3 months, we have imparted trainings to more than 300 participants, and many more are in the pipeline in the coming months. The participants include in-service candidates from government and private sector both. Many have attracted participants from the neighboring countries such as Bhutan, Myanmar, Afghanistan, Nepal, Sri Lanka, and Maldives. Some of the training programs have also been sponsored by the National Health Mission of different states. This, we firmly believe, is our investment to improve the performance of health sector on the whole. IIHMR Delhi is sensitive to the national needs and the country's vision to upskill health professionals for delivery of better care. Aligning with this vision of capacitating young workforce for a better tomorrow, we have signed an MOU with Health Skill Sector Council of India, and we are working together to develop much needed courses such as telemedicine. Now coming to academics, which is a core strength of IIHMR Delhi, more than 1,200 students have already graduated so far, and we are continuously striving to improve the academic contribution of IIHMR to public health and hospital industry. We are revisiting the quality assurance mechanism of our academic programs. We are also committed to improving the interaction of students and faculty with industry leaders under the guidance of Industry Institute Cell. This year, we have launched the 3 years long fellowship program in management, which is called FPM, and this program will equip students with research skills that is so very important for better management. Executive program in hospital management is a 10 months long course with weekend classes meant for in-service professionals. We are currently running the second batch. The certificate course in supply chain management is for 3 months program that caters to the requirement of health managers. We have already completed the first batch, and the second batch will be starting very soon, and there is a lot of demand for this course. On the request of National Health Mission of Odisha, we are developing courses for upskilling the public health professional at the sub-district levels, in the block level, through 2 programs, and those are Executive Masters in Public Health Management and Postgraduate Diploma in Public Health Financial Management. We are also receiving requests from some Asian and African countries to have tailor-made and customized courses for them to train their health workforce. So students, on this day of 20th August 2021, we will be conferring degrees to more than 100 trained and qualified health and hospital managers. Having completed the academic requirements to earn a PG diploma, which is considered equivalent to MBA, the students will now be the warriors in different capacities across health and hospital industries. We are very sure that you will continue to hone your social and professional skills as demanded by your organization wherever you are working. 20 years from now, you should not be disappointed by the things you could do but did not do. So there is a small advice from our side that never judge the value of your work in financial terms. Learn to take responsibilities and ownership, and I'm very sure that this attitude of yours will take you very far. We wish to look up to you as eminent professionals as you join the IIHMR Alumni Network today. We would be delighted to see a visionary in each one of you who can enlighten our students in the days to come. Life has no limitations, so don't wait. Make memories today and celebrate your life tomorrow. I take this opportunity to thank the Management Board, the Governing Board, our Academic Advisory Council, Trustee Secretary for their continued support and look forward to guidance from them again. I also take this opportunity to thank my deans, faculty colleagues, staff, and everyone from IIHMR and outside IIHMR for their wholehearted support in all our endeavors. Thank you.
Thank you, ma'am. With this, we request Dr. S.D. Gupta to declare the convocation open.
Good afternoon. I'm happy to declare convocation open.
Dr. S.D. Gupta is a leading public health professional with distinguished academic and research career. He obtained his MD in preventive and social medicine from India and PhD in epidemiology from Johns Hopkins University in USA. He has done pioneering work in creating and establishing a new discipline of health management and promoting research in health policy, health systems, and program management. He has chaired several committees on scientific research and health management. Dr. Gupta is a recipient of Kimpro Gold Standard Award 2009 for healthcare. We request you, sir, to deliver the presidential remarks.
Thank you very much. Am I audible? Am I audible? Hello?
Yes, sir,
Am I
you are
audible?
audible. You are audible, sir.
Hello?
Sir, you are audible.
Okay, thank you. Thank you. I'm really honored to have been invited to this very important convocation ceremony, which is a milestone in any academic and research institution. Let me, at the outset, welcome Dr. Rodrigo Ofren, WHO India country representative. We are very thankful to you, Rodrigo. I'm calling him by first name because we are known to each other for more than 25 years since he came to WHO Seattle, and we have worked together. And I'm very delighted that to hear that you joined as India country representative in New Delhi. So welcome, Dr. Rodrigo, to our institution. Dr. Harsh Mahajan, we are very happy that you could make it to this convocation ceremony. Dr. Ritu Garg, Dr. Bajaj, and other dignitaries on the dais. I'm very happy to see you all and welcome to IIHMR Delhi. It's a very important event, as I said, and very dear students, this event is mainly for you. And we are very thankful that such dignitaries who are sitting on a dais agreed to come to this convocation ceremony and hand out degrees to you for your excellent learning and skill development in 2 years' time. This is a great reward you are going to get today after 2 years of hard work. This year has been very difficult for all of us, not only for we people, but everyone in this country and everywhere in the world, and you'll know why. But I would like to give credit to our faculty who managed to switch to new ways of teaching, particularly online and using audio visuals and trying to make students learn and communicate the concepts of particular areas. So we made it, and you all have made it very successfully. And we are still waiting that when the institutions open, we'll be very happy. But despite all difficulties and adversities, you have made it, and you really deserve this award at the degree. But Dr. Sutapa has shared that how have we grown, how we have come this far. And our dream is that IIHMR Delhi, this international institute, if you notice, the name is International Institute of Health Management Research. Our main campus was and is in Delhi, in Jaipur, and which has now become a university called as IIHMR University. So we were doing a lot of work, and we worked closely with the WHO. But then we felt that we should get formally into international arena, and we decided to come to Delhi and set up International Institute of Health Management Research. Now we are in the 13th year of our establishment. Since 2008, we started admitting students, and this program was launched in the year one itself. And since then, over 700 students have graduated in management of hospitals as well as healthcare. So now a very strong alumni of all the campuses, Jaipur, Delhi, and Bangalore. We have produced over 4,000 experts in managing healthcare in this country. They have not only contributed in this country, but neighboring countries as well as in the Middle East. So I would say your predecessors have done a tremendous job and they have immensely contributed. When we started in 1996, the first program, postgraduate program in hospital and health management, everybody was talking about what it is going to make, such a small numbers, what they will achieve, and whether they will be accepted by the medical community. It was a really important question and a very significant question at that time. But we were quite confident and continued with our work. I'm very proud to say this is for our dear students who are graduating today. Your colleagues, your predecessors have immensely contributed in transforming the whole concept of managing healthcare and hospitals everywhere. So the contribution has been immense. You are now today joining the professional world. You are no more students. And the world is very different than what it is in the education institution. It's really very ruthless, rude, and you are by yourself. So you need to be careful about your own growth and how do you conduct yourself and how do you carry the image of the institution from where you have graduated. You have to make all efforts to make it that way as it has been, and I believe you are going to take it forward. Some tips I would like to give to you to be effective. Everybody wants to be successful, but not necessarily that everybody becomes that much successful. What are those attributes that you should have or you should cultivate in yourself? I think important thing is that learning is a continuous process and you learn all through your life. So continue to learn, continue to build your knowledge, learn very important things to continue to learn, and for that you need to have listening skills. And then you will listen and learn. So that is very, very important. Be careful, try to explore, try to learn, and keep on learning. That is very, very important thing in life. Be optimistic and positive always. Believe it that you have to decide about yourself always. People may sympathize, people may empathize with you, but you are the persons who will conduct yourself. So therefore, you have to keep yourself mentally fit. So the key to be mentally fit is optimism and positivity in your attitude and behavior. That's very, very important. So keep that in mind and try that you are able to give hopes to people, those who are deprived. That's very, very important. And you will see the pleasure of giving. And that pleasure of giving is really eternal. That gives an eternal feeling. You will be a very satisfied person. So this is very important. And then integrity, what the profession would require, your employers will require your integrity. Not only your knowledge, your competencies, but the integrity part is very, very important in the professional world. You need to learn to respect the opinion of people. You may agree, you may differ in the opinion of the people or your colleagues, but you need to really learn to respect the opinions and views of others. You may disagree, but yet it's very important that we need to treat people with dignity and respect. That's very important. We need to keep in mind. Today you will be joining the health profession as managers, most of you. Some of you may be researchers. Some of you might go into academics. Some of you might decide to continue your higher degrees or higher academic programs. But someday I would always wish many of your predecessors are now heading institutions. They are the chiefs of their organizations, and they have assumed leadership positions. So must plan to rise and ultimately should play a leadership role in next 10 years or so. So what I'm trying to say is you need to, for that it is important you know yourself, define yourself, define your goals, define how are you going to achieve your goals. That's very, very important. And keep focused on the institutional objectives and goals and your own goals. And it's very important for the institution as well as for you. When these two synchronize, you grow and the institutions grow. So it is very important that you develop your own individual development plans and develop your own activities that will be necessary to develop. But for that, it is important first understand yourself, do a self-analysis, do a self-goal analysis. That's very, very important. In the professional world, it's very important to communicate properly. Writing as well as verbal communication is very, very important. Communicating your ideas, always try to keep sanity in making your observations and comment, though this is against communication. But it's very important that you need to communicate, make your presence felt with your wiser advice and comments in the meetings, contribute to the learning process, and you should be willing to learn. That is very, very important. So many things I've just talked to you might sound, it's very ideal, very hypothetical, but I can tell you all these are very important and you will realize. So better it is you prepare yourself. You are going to join the professional world now, and you will go through the stresses. The time has changed, the world has changed. What we saw 30 years back or 50 years back, it's so different. The way of working has changed, the disease burden patterns have changed, the systems and organizations have changed, the technology has changed. So you have to cope up with all that, and in fact, you are the instrument of change. So we have a lot of expectation from our younger generation. Like persons like me of my age are quite, reluctant to change, but this is important. And many of us have changed to where we are, and that's why we are still continuing and contributing. So it's very important, and very important thing that I like to share, and I like to communicate to you all. This is very stressful life in the professional world. Keep yourself fit. And that is where the happiness will come in. So positivity, optimism, and good health should help you to carry through successfully. So I would like to wish you all a great success. And I would also like to congratulate you all and your parents who have sent you for education at IIHMR. They have their expectations and hopes. They would like to see you rising and effectively contributing. As Dr. Sutapa has said, job is never a problem. So don't run after. First try to learn. First 2 years, 3 years, should not jump over from here to there. Stick to a job. Learn on the while you are working. Gain experience. And I can tell you the management professionals in healthcare and hospitals and in research, there are no limits to grow. But first 2-3 years, you gain experience, learn what is the real world, what is the real setting in which you have to work, you have to live and grow. Everyone wants to grow as well. So, but continuous learning is very important. Focus on your personal growth as well while you work for organizations. My best wishes to all of you. And thank you all for being with us and our distinguished guests sitting on the dais. I'm particularly very thankful to you all to have you with us this evening. Thank you.
Thank you, sir. We once again welcome our guest of honor, Dr. Shuchin Bajaj. Dr. Shuchin Bajaj is the founder director of Ujala Cygnus Hospitals. Ujala Cygnus is currently operating 12 hospitals in Delhi, Uttarakhand, Uttar Pradesh, and Haryana. Dr. Shuchin is a highly qualified medical scholar. After completing his MBBS from PGIMS Rohtak, he did his doctorate in internal medicine from Dr. SN Medical College, Jodhpur in 2004. Dr. Shuchin has won many accolades and awards for his work, including British government's 2015 Chevening Gurukul Fellowship for Leadership and Excellence Award at King's College London, Worldwide Achievers Healthcare Excellence Award 2014 for Healthcare Excellence in Internal Medicine in Delhi and NCR, National Award for Excellence in Healthcare 2015. Over the last year, Dr. Shuchin Bajaj has been fighting the war on the pandemic as a frontline warrior and has also been a core team member of Project Step 1, helping 16 state governments manage their COVID response. Sir, we request you to kindly address the audience.
Thank you very much for that extremely kind introduction. Dr. Rodrigo Offrin, Dr. Harsh Mahajan, Dr. Ritu Garg, Dr. Sutapan Yogi, Dr. S.D. Gupta, Dr. Ashok Agarwal, Ms. Divya Agarwal, all the faculty, guests, staff, and my dear students. Thank you very much for having me here. When we just came in, Nikita ji very kindly told me that you have 7 minutes to go up and speak whatever you want. So I thought I'll give you 7 mantras from my life that I wish somebody had told me when I was starting out. I come from a very resource-constrained background, but luckily I had the benefit of very good education like you people. And when I was starting out, I had this one issue in my mind always. I was doing my super specialization in a very big, one of the biggest hospitals of Delhi, and most of my friends, family, and relatives were still struggling to make their ends meet, and they would sometimes call me saying that, you know, somebody's had a heart attack or somebody's had a head injury. Can you help them somehow? So on the one hand, it felt very nice to me that I was in now such a position where I could help my family and friends. But on the other, it always kept knowing me from inside, why did these people have to travel all the way to come to Delhi from their villages, from their small towns, and why could they not have this facility that I was trying to provide them within their own small towns? So this was the problem I started working with. I did not jump to conclusions. So the first mantra is always identify the problem well, right? The problem was not really that they couldn't come to Delhi fast enough, right? So I was not looking for faster ambulances. I was not looking for smoother roads to get them into Delhi. The problem was they could not afford medical care to come to Delhi, either financially or geographically or linearly. They did not have the time, the money, or the means to come to Delhi. So that was the first problem I identified and started working towards it, how I could provide good quality healthcare services within their small towns. So the second mantra is, please get out of the channel surfing mode as quickly as possible. because the current generation and all of us, we just keep switching channels and never find anything which is good enough for us, right? 56 channels and nothing on is always on my mind. So we'll just keep switching channels. This is not good enough. This is not good enough. This is not good enough. And finally we'll realize that we're out of time, and now we'll struggle and take on something which is a compromise for us, which we don't really feel like doing, but everybody's saying it's already been 5 years, 6 years, get into something at least, right? So get out of the channel surfing mode, identify one problem and try to solve it as well as possible. There will be many obstacles along your way, don't worry about them. Try to do whatever you can do to overcome them. The third mantra, of course, is very important. When you start doing this, always prioritize Saraswati over Lakshmi. So always Saraswati, never Lakshmi is my mantra, which I take to heart very, very closely. You are not meant to, work out Excel numbers or Excel sheets or financial reports. You are in the healthcare sector. You are meant to change people's lives. You're meant to make an impact on them. You're meant to make them live better. So always pursue that. Never be shy of leaving anything which you feel does not gel in with what you started out to do with, even though it's paying you twice the salaries or 3 times the money. So never go after Lakshmi. Lakshmi will almost always come to you if you are making Saraswati happy. The fourth mantra, of course, is try not to fall too hard. So always try to keep your failures manageable. I don't know how many of you have heard of Langley, but I'm sure most of you would have heard about the Wright brothers, right? But Langley was the first person to actually try to make a plane. But he put all his money, all his energies, everything into 2 seaplanes, one of which sank overnight and the other one flew for like 10 seconds and then sank. So the next day, the New York Times had a banner headline on the front page saying it will be 1,000,000 years before humans take flight. And precisely 17 days later, the Wright brothers flew. Nobody was looking at them, but they were failing every day. They knew they would fail. They would take 7 or 8 parts and go into the fields because they realized that they would crash 7 or 8 times every day. But the thing was, they kept their failures manageable. They didn't lose their shop over those failures. So when I started out, I kept my failures manageable as well. As I told you, I had no money when I started out. So it was not like I identified a problem and said, okay, I'll build a big hospital and go into Panipat with a 200-bed hospital, sell my house to do it. That was not how I started out. I started out very small, 10 by 10 small clinic. My initial budgets would be like, can I buy a glucometer this month, which is worth 200 rupees? Or should I buy a nebulizer, which is more important for my patients, but it is 1,500 rupees. So can I spend those 300 rupees extra? And many times the answer would be no. So try to keep your risks as manageable as possible, because you will definitely fail. That I'm promising you. Nobody can work out something very clear that you succeed and keep succeeding. But try and fail as softly as possible, and always try to fail forward. Learn from your mistakes, do something that is better than last time. So it's not like we have 14 hospitals right now, so we started out and built each and every one of them. We closed down 2 or 3 as well because they didn't work, right? So it's not like you will not fail, but try and keep your failures as soft as possible. Fifth, of course, is get rid of the imposter syndrome as quickly as possible. You will face it many times in your life, especially in the early years. You'll feel that, why are they giving me this bigger responsibility? Why are they giving me this bigger role? I'm not really, qualified to do it. Are they sure that I can handle it? You will have this feeling each and every time you are given a responsibility which is bigger than what you feel you are qualified for. But rest assured, you're being given that just because you are the right person to do it. So try and do a higher kind of a responsibility rather than a lower one. As I said, you'll fail, don't worry about it, everyone will, right? I have this imposter syndrome almost every day. Standing in front of you with such exemplary luminaries of the healthcare system here, I don't think I'm qualified enough to say anything which you will learn more than you've already done. But I've spoken at the WHO, I've spoken at the UN. I sit on the board of FIT at IIT Delhi, an organization which my father tried my best to join, but which I felt at that time I was not capable enough of. Now sitting on that board there, I feel that I'm not really the person they need. Why have they invited me here? It's the imposter syndrome every time you will find it, right? When I was sitting like you on my graduation day, if somebody had told me one day you'll be heading an institution, an organization with a turnover of hundreds of crores of rupees, I would have laughed in their face. I would have said, are you crazy? I don't even have 10 rupees in my pocket right now, which I don't even have now, but that doesn't matter really, right? So get out of that imposter syndrome, believe in yourself. If you don't believe in yourself, then who else will, right? So believe in yourself always and make sure that you get a higher slice or a bigger pie of what you are trying to do. And the last, of course, mantra that I want to share with you is always share as much as you can. See, there's a Sea of Galilee, which is, I don't know how many of you have been to the Middle East, but it's one of the richest ecosystems ever in flora and fauna. It's such a wonderful sea. Just down the line in the same ecosystem is the Dead Sea, right? It has nothing. It is absolutely dead. And there's only one reason. Sea of Galilee has an inlet as well as an outlet, whereas the Dead Sea has only one inlet, no outlet. So if you're not letting out your knowledge, not sharing it with others, not making sure that the people around you are doing as well as you are, then your progress will be, very, very little, and you'll always do much lesser than what you were meant out to be. So these were my mantras for you. Thank you very much, and I hope you'll be very successful in your life. Thank you. And of course, one more thing. I would have been very happy if somebody had stood up and said, these were only 6. You promised 7 in the beginning. So the most important mantra, always be very skeptical and take it with a pinch of salt whenever anyone tells you anything, especially if it's the person standing on a dais with a mic in his hand. And always be very careful about your numbers. They are the most important part of your career. You can improve only the things that you can measure, nothing else. So be very careful about your numbers and never be afraid to stand up and hold a person accountable to the promises they've made you. So you stand up right now and say, where's your 7th mantra? You didn't give it. Never be afraid to do that. Thank you once again, and I wish you all the happiness, success, and laughter in your life ahead. Thank you.
Thank you, sir. Now we would like to welcome our guest of honor for the evening, Dr. Ritu Garg. Dr. Ritu Garg is an ENT surgeon and turned to healthcare management after spending 12 years in premier medical schools of India. Dr. Garg has handled senior leadership roles across functions and organizations like Fortis Healthcare, Sakra World Hospital, and MLOP India. As head of strategy at Fortis, she led the development of organizational blueprint, medical program strategy for the group. Dr. Garg also led clinician recruitments, academics, trainings, and patient experience functions at group level before moving to the current role as Zonal Director and Head of Fortis Memorial Research Institute, Gurgaon, the flagship hospital of Fortis Network. We request Dr. Garg to guide us and address the students for their future endeavors.
Thank you very much. Just take this mask. Respected, distinguished guests, Dr. Roderick, Dr. Mahajan, Dr. Bajaj, Dr. Neogi, Dr. Gupta, Dr. Ashok Agarwal, Ms. Divya, respected members of the Management and Governing Board, the Director, esteemed faculty, dear students and parents. It's an honor to be here with you this evening. This is indeed an incredible moment in your life, which you're going to stay with you forever. Last year has been the most challenging for the entire world as we all learned to recalibrate and relive our lives. I can only imagine how hard it would have been for you all to manage in that situation and yet complete your studies. The fact that all of you have successfully completed your course and have come out with flying colors is testament to your own resilience and diligence. So heartiest congratulations and very well done. Interestingly, during these challenging times, healthcare sector is the most relevant in the world. I don't think there is any boardroom or a political circle, drawing room, or anywhere where healthcare is not being discussed today. In that sense, this is also the most opportune time for you to graduate as healthcare managers. And this opportunity is immense. I am sure all of you have seen the gaping holes and gaps the healthcare systems across the world have exposed in last 1 year. And this is the onus of fixing all those is on us as healthcare sector, both private and public, and with young minds like yours. During your time here in college, inside the classroom, outside, I'm sure you must have had lots of debates, discussions over coffee, online forums, and many ideas would have been germinated. Many of you would have thought maybe this is the way to do it. I urge you all today to not let those ideas die. Keep them alive with you. You may or may not get an opportunity today immediately to experiment with them or to execute them, but it will come tomorrow. So continue to nurture those ideas that could be transformational. Some of those are going to become the unicorns. And these could be in the form of your own startups, or you team up with other teams, or maybe work with any company. But the passion, that idea that you've germinated over here, that is going to make your life meaningful. And that is what is going to be your differentiator. And yes, when that opportunity comes, somebody might stand up and say, you're not ready. Someone will say, you're not experienced. But don't let that dishearten you. And here, I would like to share a personal example. So 4 years back, I took over a hospital of a network here. It is a flagship hospital. It was going through its toughest time. I got to know that there was a change of leadership planned, and they wanted someone to head the hospital. So I raised my hand and said I would be interested. And I was told, but you've never managed a hospital before. This is the flagship for the network. 1,800 employees, it's the marquee programs. While you've done everything else, but you've really not managed the hospital before. So I went up to the senior leadership there. I said, okay, but I would still want to be interviewed. I think we all deserve a fair chance. So I went home, I did all the research, put up an action plan. I was called for the interview. It was interviewed, there were 4 or 5 people. Many of them were running hospitals since 15 years, 10 years, and I just walked into the room. And all I presented, I think that day, was just the passion and the plan to turn around that hospital. I'm glad that somebody in that room did believe in me, and there has been no looking back. I think that team that day, the panel, can rest assured with their decision that they left it in the right hands. The reason I'm sharing it with you is that somebody is going to give you that chance. So you are ready to take on any role the moment you feel you're ready. Forget about the skeptics and naysayers. Just don't bother. You will have to believe in yourself and persevere. And yes, it's not going to be an easy road. It'll be bumpy. There will be ups and downs. There will be sleepless nights. But guess what? You'll pull through. We all do, as long as you believe in the idea, as long as you are associated and own the idea that you're working for. And that is the thought that I would like to leave to you. I wish you all the very best and welcome you all as professionals in the healthcare sector. It is a great sector to be in whichever form, and I'm sure that we have a long way ahead and we can do so much more. So thank you very much, and wishing you all the happiness and success in your life and career. Thank you.
Thank you, ma'am. We now welcome our chief guest, Padma Shri Dr. Harsh Mahajan. Dr. Harsh Mahajan is an eminent radiologist who is founder and managing director of Mahajan Imaging, which runs a chain of diagnostic centers in Delhi. He did his MBBS from Maulana Azad Medical College and MD in Radiology from PGI Chandigarh. Dr. Mahajan has done his fellowship in MRI in famous MD Anderson Cancer Center in Houston, Texas, USA. He is credited with setting up one of the India's first MRI centers in 1991 and has been a key figure in bringing many new technologies into the country. He has been an invited speaker to MIT in Boston, Radiology Society of North America in Chicago, European Society of Radiology in Vienna, and has lectured numerous countries around the world. Dr. Mahajan is an active social worker associated with several NGOs. He has received many accolades and awards, including the Padma Shri in 2002. He was the National President of Indian Radiology and Imaging Association in 2012 and is consultant to many government and private organizations. We request Dr. Mahajan to kindly deliver a keynote address to the audience.
Thank you very much. Good evening. Eminent dignitaries on the dais, off the dais, and young leaders. Those days of freaking out are over. You know, you could come when you wanted, you could go when you wanted, and your teachers would be chasing you. That generally happens, doesn't it? Though you had one year when it was just probably online and you were sitting at home. But we all, when we reflect back, when we are working, we say those were the best days of our life. And when you are actually in college and learning, you don't know that. So, but I would say the best days of your life are ahead of you, because what you've learned here, what you've imbibed over the years, the interactions that you've had with your teachers, the interactions amongst yourselves, and the peer group is very, very important. You're all going to go to different places, and there will always be a friend for you wherever someone from IIHMR is there. And it's a great brand. They do great work. They teach you well. And now's the time when you will have to translate what you learned on the ground in making a difference, not only in hospitals, as Ritu has done, or as Suchin has done, by creating hospitals not only in the metros, but in tertiary, in tier 2, tier 3, and at affordable price. And you are the people who are actually going to be running these hospitals, be running those diagnostic centers, running those research centers, because most of us doctors haven't had the privilege of going to a management school. I mean, some of the terms which are used, you know, offhand by youngsters, they are Greek and Latin to most of doctors. And that's why they will look up to you. You may be much younger, and there's a senior consultant, but there's a kind of knowledge that you have which will make a difference in running a hospital, in making a patient comfortable, in providing better healthcare, using the same tools, the same people, the same doctors, the same nurses. That is where you can make a difference, because systems matter. What you've learned matters. And so, while you're doing this, the most important thing is enjoy it. Because if you enjoy it, it's not a job. And that's why, for me, the best time I had, of course, we had a great time in school and college, but the best time we had was when we were working. You know, and the cliched term is work is worship, but I believe it's more like meditation. I'm more relaxed when I'm working than when I'm, you know, at home, maybe watching television or playing with kids. So the second thing, and I don't have too many points, and I will never count like Suchin did because I'll forget. You will aspire for a position, you will aspire for a job, you will aspire that this is what I want to be. And not everyone is going to get that job, because for every job, especially in this country, there'll be 200 applications. And people who are equally qualified, people who are as good. But whatever position you are at, give it your all. Radiology for me was my second choice. I wanted to do medicine. And it's just, now I've even forgotten why I wrote the entrance exam for radiology when I went to PGI Chandigarh. I wanted to do medicine. And at that time, there was no common entrance test. You had to write a separate exam for whatever subject you wanted. And, I was first on waiting list in radiology, and first in radiology, 2 seats in each. And I was given 4 seconds by professors like these, sitting on a stage like this, given 4 seconds to choose between the two. And definitely I believe God plays a role every step of the way. And, I chose the right thing. I was pretty unhappy for the first month or two, but then you get to like something. And so what I'm saying, irrespective of what you become, healthcare is a huge field. And maybe some of you will transcend healthcare and go into other fields. Do your very best and you will rise to the top. And frankly, you youngsters have so many varied opportunities. The pandemic has opened up opportunities in healthcare like nothing before. Everything is changing. Digitization coming in a huge, huge way. And if there's one thing you can do well, learn the computer. Learn it well, so that people can't take you for a ride. You're supposed to be the manager. And so that would be very, very important. And at the end, I would say that we do have one of your graduating students who works with us, Bhanushri Bahl. She's here. And, she works in our Center for Advanced Research in Imaging, Neurosciences and Genomics, and working in the field of artificial intelligence, which I believe is the future. So be digital savvy. I know most of you are, much, much more than what we are. But also be focused, because the web is a wild place. It can be useful. It can also be detrimental to what you want to do. So don't get lost in the huge sea that is there outside. Be focused. And Ritu and, Suchin have given you many homilies. And they are all true. In fact, I was complimenting Suchin that I really enjoyed what he said. And each and everything that he said holds value. So, but at the end of it, it's your destiny. They say, the lines of your hand, but you have to do your part, as the Gita tells us. We can't sit and be honest, be loyal to the organization, be sincere to everyone, including the patients. And has already been said, Saraswati and Lakshmi, they go hand in hand. But if you go for Saraswati, for Lakshmi, then, things may not work out. And also remember, and I'll end with this, changing jobs very frequently is not a good idea. Because unless you've shown stability, it may seem jumping one to the other, to the third. Hey, I was getting so much, now I'm getting 30% more, 50% more. And then you will see at 45 years of age, no one wants to hire you. And this is a reality. So be stable, be useful, be tactical. It's not that Bhagwan sab kuch nahi kar dega. And at the end of it, I'll say, this is something I say, that you have to chart your own paths. And you have to have a dream and a vision and a goal. And then, wherever life takes you, go forcefully. And I end by saying, मंजिलें उन्हीं को मिलती हैं, मंजिलें उन्हीं को मिलती हैं जिनके सपनों में जान होती है, पंख से कुछ नहीं होता, हौसलों से उड़ान होती है. So all the best, enjoy.
Thank you so much, sir, for the wise words. Now we would like to welcome our distinguished guest for the evening, Dr. Rodrigo H. Offren. Dr. Offren comes with a rich experience of over 2 decades in public health, mostly in WHO's Southeast Asia region. Before taking up his current position, Dr. Offren was the Regional Emergencies Director for WHO Southeast Asia region, providing strategic, technical guidance and operational leadership to the ongoing response to global COVID-19 pandemic across the region. Associated with WHO since 2002, Dr. Offren has served in multiple roles, starting as a public health officer in war-ravaged island nation of Timor-Leste, assisting in setting up of its health systems. Dr. Offren has spent the major part of his career and has been in public health emergencies programs ever since. Born in 1968 in Philippines, Dr. Offren holds a Doctor of Medicine from a University of Philippines, a Master's in Public Health from Hebrew University, Hadassah, Israel. Dr. Offren was conferred the Director General Reward for leading Nepal's earthquake response and recovery. We welcome him with a huge round of applause and request him to deliver the convocation address.
I will also remove my mask. So I stuck with emergencies, and look where it got me. It got me till the pandemic. Yeah. Anyway, Dr. Harsh Mahajan, Dr. Sushim Bajaj, Dr. Ritu Garg, Dr. S.D. Gupta, whom I knew from 12 years ago. We set up a pilot course for preparedness for our teams all over the region. Dr. Sutapa Niyogi and Dr. Divya Agarwal. Good evening also to our IIHMR faculty and students, colleagues, and friends. I'm very pleased and also very humbled to be invited to speak to all of you on this historic 12th convocation of IIHMR. It is a profound and defining moment for all of you who are graduating from the postgraduate diploma of hospital and health management, more so because we are living through a pandemic. And again, it's very hard to speak after very distinguished guests who are all very good speakers. I have my points, and I will have to try to be better than that. My heartiest congratulations. I think this day is for you. To all the graduates who will all become invaluable resources in our journey towards making health services accessible for all. I think that's one of the reasons. Please, in your heart, always go back to the reason why you wanted to be in healthcare, health services, public health, hospital care. For today is not a day of where your education ends. It's a great beginning. Especially at this point in history, where health is a focus. No other point in time have you seen every head of state, every budget, putting something in healthcare. Most of its resources in healthcare. So I guess congratulations, you made the right choice, and you have to stick to it. It's a lifetime of learning, that's the other thing. It doesn't end with this graduation. The world is changing so fast, and I'll talk about it a bit later, because sometimes the expectation is your WHO is, okay, when will this end? This is the only question I get every time. I also offer my congratulations to all the parents and of course the teachers. This is a proud moment for all of you. IIHMR is a pioneering academic institution in India. I worked with Dr. Gupta and his team in Jaipur, and it was only a few years later after that that the Delhi campus was set up. And it has grown so much for education, research, training in health systems, and my appreciation to all the faculty and staff and leadership of IIHMR. It's a great institution. It has grown so much. We've heard so much of the achievements, and we've been working with you a lot in different areas of public health. I think it's time to also talk about the world you will be entering in. Health systems around the world, including India's, are being challenged by the COVID pandemic. From the outset, from supplies of PPEs for health workers, supply chains being stopped, lack of medicines. It was just a problem after problem after problem. We know that when health systems are overwhelmed, both direct deaths from an outbreak and indirect deaths from preventable and treatable conditions increase dramatically. So you're entering a world not just of COVID, it is compounded problems also of other health conditions, and maintaining even essential health services. And sadly, the gains of health systems from previous decades have also backtracked, including immunization, access to safe deliveries even. And I think many of the colleagues in the dais are all working towards that. Please make sure that that's also your goal, that it's to provide access for healthcare. We all must work to build resilient health systems. Every time you think of your work that you will be entering, it's how will that be affected by a crisis? I always went into that. People would always ask me, in a batch of 172 students in medical school, I think only 6 of us went to public health. And that's quite sad. It's many for some batches, but it's quite sad that from a poor country, only 6 will go into something that looks at preventable diseases. So, and how to prevent diseases. And I think that's where I came from in terms of my mindset. How do you prevent something? Of course, I am from the Philippines. I come from a country where throughout the year, the alphabet goes through a second cycle of naming the typhoons. So the cyclones were like that. It's like, you know, when I came here first and they said monsoon rains in Delhi, this is monsoon. This is like, this is a drizzle for me. Monsoon is 9 days straight, etc. I guess other parts of the country do experience that. That's the same way I experienced it. And even with that, we should be thinking about how, you know, a system can absorb shocks, epidemics, pandemics. That's always where I went. My head was always there because that's how I grew up and how was healthcare delivered in these challenging times. And COVID-19 is not any different. It cannot be beaten by one state, one region, one country alone. No state or region will be safe until everyone is protected in each community and family. Never has been there a time also for health where science has really progressed. There are 200 candidate vaccines since last year. There are, I think, 16. Of course, some are already approved and being used. But don't you think that for diseases like TB, where there's a possible vaccine that has never happened in its 30 years, for HIV, the same thing. How did that happen? We are in a world where science is moving fast. And it's a powerful tool against disease. more than 485 billion doses of the COVID-19 vaccine have been given, and still it's not enough. It's still more. There is so much inequity. It's more in the developed world. They're even thinking about booster doses while other countries have not even covered 5% of their population. In India, it's 572 million. It's a phenomenal number of doses given. It's 30 per 100 population for 1 dose, and around 9 per 100 population for 2 doses. But still, that's not enough. It's well established that COVID-appropriate behaviors can prevent transmission. Sometimes we are all thinking about what's high-tech, what's next, what's that. But there are things that actually work, and sometimes we don't look at that. Basic surveillance, proper reporting, testing. There's a phenomenal increase in testing in this country from 2 labs to 2,000 in less than 4 months. New technologies for diagnostics. But there are things in which I think the important message is that please bring back the public in public health. This pandemic is in the hands of experts, governments, etc. It's easy to blame. But there are many who will not wear their masks. They will attend a shadi of 200 people, and it's, yeah, that's the start of a big outbreak. It's a super spreader event. It's sometimes it's just parties, gatherings of families. So that's also part of your work as health professionals. It's how do you engage people to be part of health, of a health cause. Physical distancing works, masks work, hand hygiene works. Not just for COVID, but for all other diseases. Don't you notice there also has been a decrease in influenza cases because we've all been wearing masks, and there has been this observation of COVID-appropriate behaviors. So there are, not that we will wear masks forever, but this is the world we are entering. We have a team of 2,600 personnel in 23 states. And that has been a tough job for me because to me, it's not just supporting the pandemic response. It's about also supporting the team that's being out there, out in the field, our frontliners doing house-to-house surveys, and many of them got infected, and some have actually passed away. So in your world, when you enter the professional world, as you enter, do take care of your teams. Do take care of people. You're not there for yourself, and you will never be a success if not for the people around you. COVID-19 has pushed us to reimagine healthcare delivery. Maybe many of the things you have learned you have to question. As Suchin said, be skeptical. Is this correct? Is it more people that you need? Maybe you will need AI diagnostics more than more readers of your X-rays, let's say, which is already happening. There are technologies like this. So reimagine, rethink, because that's the only way it can move on. Yes, there are achievements in the response for the pandemic, but basically, we all forgot to prepare. I think that's what people don't remember. Why was it possible to have 2,600 RT-PCR labs now when you only had 2 at the beginning of the pandemic? And at least for India, you were able to scale. There are other countries that are not even able to provide this. But that's the point. There will always be a need for services. So the rethink in our heads, what will happen if, let's say, even just a simple flood that keeps returning every year. You wouldn't want to have the health investment washed away every monsoon. And people still, to this day, the systems are not, how do you say, risk designed to protect people and to protect health. So I would challenge you to reimagine. It's not even a rethink, just reimagine what's possible. What could you do differently and better? So each one of you really has a critical role. You will be all in different fields. As Ritu was saying, in any form. You are in the healthcare sector and you will be a contributor to the rebuilding and the recovery of from this pandemic. It has to be a healthy recovery, an efficient, affordable recovery, and a green recovery. Every healthcare facility that you will be working in, do think about its carbon footprint to the planet. Is the health facility powered by solar? How are you managing the waste, medical, solid, water waste? How are people behaving? How are you managing your PPEs? We're using so much. So this is really the world you're entering, and these are many of these questions that we need to have a solution for. You are in a country with a big budget for health. It's an amazing 141 crore for health alone. Yeah, I know crore. I've been here for 16 years, so it's really a big investment for health. But your role will be to really make sure that this health budget reaches those who need it. There is an inequity that you also need to address. I think that's so important for healthcare professionals. And yes, there will be an investment in health, but will there be an investment to prevent the diseases that come? Sometimes the health sector is the recipient of sins of other sectors, air pollution, unsafe water. That's not the health sector, but you do receive the patients that are affected by that. As the demand for research, innovation, public healthcare services increase, the range of health services you will deliver in India will be among the broadest in the world. And you will be contributors to this. It's not a small responsibility. And I urge you just to continue learning and build your capacities from scientific advancements in the country and the world to emerge as leaders in your chosen field. I wish each one of you really the best in all your endeavors, but come back to the reason why you joined healthcare. Why did you enroll in IIHMR in a postgraduate course? That reason is so important. To me, it was just a small story, a few more minutes. I was an intern in the hospital where I was training. And every other day, the same child comes back with diarrhea. And that just really stuck with me. I cannot forget that every day it is the same advice you would give to the mother, or ORS, etc. But the issue is she did not have access to clean water. So that made me move out of the hospital. Not to say that setting up hospitals is not a good thing, but I moved further out and tried and help prevent this. So find that reason. It's so important because that's the only thing that will guide you clearly to success. And with that, I think I just wish you to move on in your professional career in a path with a heart. Please, it's not about technical things, Excel sheets, as was mentioned. It's moving in a path with a heart. Thank you very much, and all the best, and good luck.
Thank you, sir. Now, moving ahead to the most awaited time for our graduating students, we request Ms. Divya Agarwal to proceed with presentation of postgraduate diploma to our graduating students.
Thank you, Shweta. Good evening, one and all. My most important duty on this special day is to offer a warm welcome to our honored guests, graduating students, my colleagues at IIHMR Delhi. IIHMR Delhi is committed to provide students with the best possible education to prepare them for their future careers in hospital and health management. I would like to make a special mention for our all graduating students on this day who acted as our support system to IIHMR Delhi family during second wave of COVID-19. Now, with the much awaited and for which the graduating students are waiting to get their degree awarded by the respective dignitaries, I would like to announce the names of the graduating students, and I would request Dr. Rodrigo, Dr. Harsh Mahajan, Dr. Sutapa to kindly come forward to award a degree to the graduating students. Dr. Achal Singhal. Dr. Abha Singh. Dr. Aditi Dubey. Dr. Aishwarya. Mr. Aman Hassan. Dr. Aman Chuk. Mr. Anirudh Bhargav. Dr. Arpita Dhawan. Ms. Ayushi Parashar. Dr. Bhanushri Bahel. Colonel Deepak Vashne. Dr. Dhruv Upadhyay. Ms. Disha Soni. Mr. Dwij Grewal. Dr. Fatima Rashid. Dr. Gitanjali. Mr. Gulshan. Dr. Gunjan Sharma, Dr. Kanika Singhal, Dr. Kanika Wadhwa, Dr. Kriti Agarwal, Ms. Kritika Arora, Dr. Lakshita, Dr. Mehak Dhingra, Mr. Mohammad Hashmi, Ms. Monica Shailesh, Ms. Muskan Gupta, Dr. Neha Mishra, Ms. Muskan Setia, Dr. Neha Mishra, Dr. Neha Rani, Dr. Niharika Bansal, Thank you, Dr. Rodrigo and Dr. Harsh. Now I would request Dr. Ritu Garg and Dr. Shuchin Bajaj to come forward along with Dr. Sutapa to award the degrees. Dr. Paridhi Gupta, Ms. Poonam Yadav, Dr. Prakamya Arora, Ms. Priyam Singh, Ms. Priyanka Ruth, Dr. Rekha Grover, Mr. Rishabh Agarwal, Ms. Ritika Kadian, Dr. Ruchika Gambhir, Dr. Saloni Bansal, Ms. Shivani Sharma, Ms. Shivani Bhati, Ms. Shraddha Chandak, Mr. Srinath Mishra, Ms. Simran Mehrotra, Ms. Neha Gupta, Ms. Neha Khurana, Dr. Shrishti Singh, Ms. Surabhi Vinod, Ms. Surabhi Kumari, Ms. Tanushri Datta, Dr. Tavleen, Ms. Tripti Tyagi, Ms. Varsha Prasad, Ms. Vibhu Bajaj, Dr. Swati Bhandari, Ms. Vandana Sharma, Mr. Ritvik Chabra. Ms. Annapurna Chauhan. Ms. Sakshi Rana. Dr. Vishal Tevatia. Dr. Pooja Bishnoi. Dr. Reshu Mathur. Dr. Sunita Godara. Dr. Nalini Tripathi. Thank you, Dr. Shuchin, Dr. Ritu, and Dr. Sutapa. There are few students who are attending the convocation virtually, so I would like to announce their names as they have also graduated. Mr. Adarsh Veer, Dr. Aditi Dhankar, Dr. Amardeep Sirohi, Ms. Anamika Gandhi, Mr. Anand Yadav, Mr. Animesh Prasad, Mr. Anmol Sharma, Mr. Shah Mo Bashar Aslam, Ms. Bhavna Joon, Dr. Vinit Surana, Mr. Biswabasu Samantra, Dr. Debanjana Moitra, Dr. Jyoti Tawar, Dr. Shravani, Colonel Manoj, Dr. Manpreet, Ms. Nancy, Ms. Neelu Singh Chauhan, Dr. Neha Lakshman, Lieutenant Colonel Nitish Kumar, Dr. Pallavi Gangil, Dr. Priyamvada Mishra, Dr. Sapna, Dr. Shivangi Yadav, Mr. Sushant, Dr. Bandana Bhatt, Dr. Prateek Malhotra, Ms. Falguni Chaturvedi, Dr. Ittu Kundan, Mr. Prashant Kumar, Dr. Priyanka Gupta, Ms. Soma Saheti, and Mrs. Subhangi Pathak. Congratulations, a big congratulations to all the students. Thank you.
Thank you so much, ma'am.
Congratulations to all the students. Now for the names we have been eagerly waiting for. The gold medalist of the 3 streams and all-rounder gold medalist. We would like to request Dr. Sutapa Binyogi to announce the names.
So I think this is the most exciting moment that you all have been eagerly waiting for. And this is about awarding the gold medal to our students, the best outstanding students in the different streams. Shri P.D. Agarwal Memorial Gold Medals are awarded every year to students in all the three streams, which is health, hospital, and health IT, in recognition of academic excellence to honor and revere the memory of our founder, Shri Prabhu Dayal Agarwal. Shri P.D. Agarwal was a visionary, and he rose from humble beginnings to become a luminary who held a Midas touch in whatever he chose to do. Shri Agarwal had many facets. He was one of the pioneers of the transport industry in India and had a brilliant business acumen. He also realized his social responsibilities and made highly significant contributions in the spheres of education, healthcare, amongst others. Above all, he was an excellent human being who touched many lives by the time he left for his heavenly abode. Shri P.D. Agarwal still lives in our hearts. We at IIHMR consider ourselves extremely fortunate to be guided by the standards, the values, and the principles set out by this extraordinary person. So I would now like to announce the names of the students who had excelled in the three streams. Stream-wise awards are given on the basis of their academic performance solely. So can I request Dr. Harsh Mahajan, please, sir, to come here and felicitate our gold medalists. For the hospital stream, the best outgoing student is, any guesses from your side? Any other second choice? Yes, Mr. Aman Hassan. From health stream, who do you think is the topper? Second choice again? Yes, it's Dr. Tavleen Kaur Malik. From Health IT? Yes, it's Dr. Shravani Reddy, but she couldn't make it today. So I believe that it can be given to Dr. Bhanushri Behel, if you can just accept the gold medal on her behalf. Okay, thank you so much, sir. Now is the most important announcement, and that is the award for the all-rounder. Can I request Dr. Rodrigo Offrin to please come forward and felicitate the gold medalist who is an all-rounder? Any guesses here? And this all-rounder medal is given not only on the basis of academic performance, but also it takes into consideration the extracurricular activities, attendance in the classes throughout the year, the presentation in different conferences, and publications in different journals. Any choices for who can be the all-rounder of this batch? Yes, please, I can't hear you. Yes, it is Dr. Niharika Bansal who is the all-rounder for this batch. Okay, thank you so much, sir. And many, many congratulations to all of you students. Thank you.
Thank you, ma'am. Now, from here on, we request Dr. S.D. Gupta to kindly declare the convocation closed.
Thank you very much, and congratulations all these graduating students. I declare convocation closed.
Now we proceed with presenting of mementos. We request Dr. Sutapa Binyogi to present a memento to Dr. Offren.
Thank you, sir. Now, we would like to request Ms. Divya Agarwal to present the memento to Dr. Harsh Mahajan.
Thank you, sir. Now we would like to request Dr. Preeta GS to present the memento to Dr. Ritu Garg.
Thank you, ma'am. Now, we request Ms. Nikita Sabarwal to present the memento to Dr. Shuchan Bajaj. Thank you, sir. Now, we would like to invite on stage Colonel Deepak to administer the Health and Hospital Management Oath to our graduating students. All graduating students are requested to rise for the oath.
May I request you all to raise your dominant hand, please. And I'll request you to all repeat after me. As a leader in health sector, I recognize my role in the society. My purpose is to improve health through better management of healthcare. My decisions affect the health and well-being of individuals inside and outside my enterprise, today and tomorrow. Therefore, I promise that I will manage my enterprise with loyalty and care, and will not advance my personal interests at the expense of my enterprise or society. I will understand and uphold in letter and spirit the laws and contracts governing my conduct and that of my enterprise. I will refrain from corruption, unfair competition, or business practices harmful to the society. I will protect the rights of health and dignity of all people affected by my enterprise, and I will oppose discrimination and exploitation. I will protect the rights of future generation to advance their health and well-being and enjoy a healthy planet. I will report the performance and risks of my enterprise accurately and honestly. I will invest in developing myself and others, helping the health management profession continue to advance and create sustainable and inclusive society. In exercising my professional duties according to these principles, I recognize that my behavior must set an example of integrity, transparency, quality, sharing knowledge and information. I will remain accountable to my peers and society for my actions and for upholding their standards. This oath I make freely and upon my honor. Thank you very much. You may please sit down. I take this opportunity to thank all our gurus at the IIHMR and the supporting staff for making the learning for all of us easy, and especially during the difficult times we were in, we switched over to a new form of learning very fast, and I'm really thankful for their efforts and their passion with which they had taught us. As a mark of gratitude and appreciation, I would like, on behalf of the course 2019-21, present a small memento to the Institute. May I request Dr. Sutapa to please accept from our side.
Thank you, Colonel Deepak. Mr. Tarun, may I now request you to get the convocation register signed by Dr. Sutapa Binyogi and Ms. Divya Agarwal.
Now, we request Dr. Preeta G.S., Dean Research, to deliver the vote of thanks.
Good evening, and what an evening. Respected distinguished guest, chief guest, the guest of honor, Trustee Secretary, Director, Dean, and dear students and colleagues. Today is very special to all of us because our dear students are embarking on a new journey, and it is my proud privilege to be proposing a vote of thanks to all those who made this day very memorable. Let me express a sincere gratitude to our distinguished guest for sparing time to attend this function and for motivating our students by delivering the convocation address. We are extremely thankful to the chief guest, Dr. Harsh Mahajan, for being a source of support to us always and for especially coming here to motivate our outgoing students. We are indeed very grateful to Dr. Shujin Bajaj for gracing this occasion, applauding the first steps of our outgoing students. I also profoundly thank Dr. Ritu Garg for being here and motivating our students with her words. All your collective wisdom, your words of wisdom and your mantras and tips will stand them in good stead for years to come. On behalf of Director and all the faculty and staff of IIHMR, I wish to express our deep gratitude to our Trustee Secretary, who's a guiding force. In fact, he is the wind beneath our wings, who inspire us to soar higher and higher. I would like to thank our Director, Dr. Sutapa Nyogi, for always being a source of inspiration to us, for guiding us, and for always offering us support. This whole exercise was done so well by our academic team, led by Ms. Divya Agarwal, Associate Dean, and Tarun and his team, our faculty members. Special words of gratitude to our senior faculty members, Dr. Agarwal and Dr. Khokar, and all the staff, the supporting staff of IIHMR Delhi. Many have worked behind the scenes. The administrative team led by Mr. Sujaram, the IT team led by Dr. Sukesh. So our gratitude is due to all of them. Now, thank you, dear students, and your family members for making this day very special. I just want to tell you, go out, enjoy your life, have a great career, have an exceptional career, of course, but be one step ahead of being better human beings. And always remember that your alma mater is committed to improving, or it's committed to population welfare, especially the welfare of the underprivileged. Thank you, all the best.
Thank you, ma'am. We request the audience to please rise for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Ladies and gentlemen, the academic procession would now be leaving the academic hall. You are therefore kindly requested to please rise from your seats till the procession departs.
for the moment, please. We congratulate our beloved senior batch on this graduation today and wish them all the luck for their careers ahead. Yeah. We are sure that you all will make our institute proud wherever you go and will set benchmarks in whatever you do. This is the time when we say that maybe your part in our institution is over, but your memories shall stay forever. You might no longer be students, but you will always be associated with us as our proud alumni. You are now the stakeholders in managing IIHMR. With these emotions in my heart, I would like to say something. Goodbyes are not forever. Goodbyes are not the end. This simply means we'll miss you until we meet again.
Wherever you go, no matter what the weather, always bring your own sunshine. We would like to thank our lovely audience for supporting us in making this evening memorable. And last but not the least, let's cheer for IIHMR. Hip hip!
Hooray!
Hip hip!
Hooray!
Hip hip!
Hooray! Ladies and gentlemen, now there will be a group photograph for which, firstly, I'll invite all the medal holders or all the award winners to come on stage, and I would also invite all dignitaries, faculty members, and subsequently the graduated students to come on stage. After the photograph, I would request all present to kindly proceed for the dinner.
Thank you everyone. Jai Hind.
अभी बुला लेते हैं ना. Yeah, come over. Ma'am.
पल ये है प्यार के पल, चल आ मेरे संग चल, चल सोचे क्या छोटी सी है जिंदगी, कल मिल जाए तो होगी खुश नसीबी, हम रहे या ना रहे याद आएंगे ये पल। शाम का चल ओढ़ के आई, देखो वो रात सुहानी, आ लिख दे हम दोनों मिलके अपनी ये प्रेम कहानी। हम रहे या ना रहे याद आएंगे ये पल। पल ये है प्यार के पल, चल आ मेरे संग चल, चल सोचे क्या सी है जिंदगी, कल मिल जाए तो होगी खुश नसीबी। हम रहे या ना रहे